Okay, good morning, everyone. Can you hear me okay? Okay, good, great. So thank you, Lance, for that introduction. A lot of technology, a lot of buzzwords. I don't know what it means either. But what I would like to say is, again, my background is I'm Vice President for Technology Innovations at Palladium. And my presentation really is about you and about the impact you can make in the field. So I tend to use a few buzzwords in the technology side. So if you hear me, some acronym, just stop me, raise your hand, say, hey, what does that mean? And I'm happy to at least explain or go through or find an expert who can really help. So we'll talk a little bit about the innovations. Since this is a social entrepreneurs conference, I'm looking for excitement and ideas and innovations, and to be able to apply that practically in the field. So this is my team. I have a team of about 130, 135 folks, all in the field. So I have staff in Tanzania, Kenya, Cambodia, Indonesia, all local, Afghanistan, all the difficult places and local. And why is that important? It's because the places that they work are like this. So this is, on the left-hand side, rural Nigeria. This is Gimbu Hospital. Hop on a plane, Nigeria, then you hop on another plane, and you drive up the side of the mountain for 4 or 5 hours. This is where if you're a great innovator, this is where your things need to work. Also, rural Kenya, the same attributes. So if you've got a fancy technology, all these cloud-based and fantastic systems, and it's broken and doesn't work, the only way to get that repaired is getting on a transport, four-wheel vehicle, with flat tires and trying to get there to get it fixed. And that's difficult and hard. So what we try to do is do things that are relevant for the countries. Not any fancy technologies, not these things that are ideas that don't work, that work well in the US. So oftentimes people have fantastic ideas. Bobby, I've got this great iPad and I want to ship 1,000 of them to Kenya and 100,000 to Cambodia. My recommendation is resist that. Please. It's much better to work with the folks in the country and ask them what do they need. They may not need the fancy iPad. What they may need is just a simple solution first. So that's much more, and I'll talk about some ideas around that as well. So again, this is my team in rural Cambodia. So things that we do translate across East Africa, West Africa, Ebola countries, and Southeast Asia. And that's an important aspect of solutions, doing solutions at scale. So you have good ideas. It's also important to make sure your idea is scalable. And how do you know if it's scalable? How do you test that? So if you've got a great solution and it works well in one country, can you replicate it in another country? And because you replicate it, does that mean it's at scale? So you do some fancy mobile project, and you have 10 people who've worked on it in Kenya. Now you're trying to do those same 10 people in Uganda or 10 people in Guatemala. Does that mean you've achieved scale? And so I would argue quite forcefully that that's not necessarily scale. So again, I'll be able to share some examples around scale. But let me talk about a few areas. Let's start with agriculture. Or economic growth. So this is a couple of solutions we're supporting. This will be in Tanzania. The issue here is land registration, land titling. So land is constantly an issue. Who has ownership over the land? Who inherits land? How do I know that this is my property compared to someone else's? So it's nice to have a GPS coordinate and a nice Google map to say, okay, this is my land. In many of the countries, this issue is tied to women's rights and inheritance. Because what often happens is she doesn't have access and her ability to inherit land, or other people actually try to take over that from the families and others. So how do you be certain that the land that you have ownership is yours? So there's a number of solutions that we've been supporting and working on around land titling and agriculture and the land space. Oftentimes this requires satellite imagery, but what we've done in Tanzania is now use these low-end mobile phones for people to scope out and map out their the actual boundaries. And then what we then do is to confirm that we're using a UAV and drone to be able to fly the land, take images, and be able to entitle them to get together, and then produce a certificate at the Ministry and Bureau of Land Management. So to be able to really address that ownership. The same thing on the agriculture side. Can you forecast when a famine is about to occur? Can you have tools and modeling tools that says, hey, the farmers, they had 10 cows this week, and then now that he's beginning to sell his cows, he's beginning to sell parts of his land. Is that an indication of a potential famine that could occur a few years, 1, 2, 4 years from now? So being able to think about forecasting and modeling about problems before they occur. So that's another area that we've done investments in, that we're also looking for other people to invest with us. In Zimbabwe, working on the DFID side, on the agriculture program, here it's the farmers are coming to market. They've got their produce. Of course, they want to offer it to sell. And so we've been working with some local folks in Zimbabwe is to create a eBay type auction system for farmers, so they can offer up for their goods and services. Everyone's very familiar, hopefully, with mobile money, M-Pesa, mobile money where you send mobile payments by phone. It's very widely used. It's achieved scale. It's one of the success stories in East Africa. But the question is, can entrepreneurs use this in order to also make money? So there's been a number of groups, companies that have established within this, under this ecosystem. One is Chimianga. They do microinsurance. So if you can have people send money, can you also have people pay for insurance? Can people actually pay for healthcare? And so being able to leverage the mobile payment is another great opportunity for social entrepreneurs. And it's not just Kenya, Afghanistan, all these hard to reach countries where you can't, physically you do not want to carry cash, are great opportunities for social entrepreneurs. In the governance and civil society area, there's a lot of open source, freely available software around social media. And whether or not it's Twitter, Facebook, but if you're a social organization and there's always corruption in the government, or you have advocacy, whether that's gender-based violence or women's rights, how do you get the people together to be able to collect who they are and to be able to have an advocacy platform? So there's a number of tools and solutions that are out there that are free, available, open source. One that I recommend is called Civic CRM. CRM is constituency relationship management. It allows you to create your mass campaigns online as well and organize, and it's low-tech approach. But these are tools for civil society organizations to be able to organize and advocate to the government. We've also are supporting what's called citizen engagement tools. So for example, I think this one is Tanzania, yeah. You go to the hospital and clinic, and you arrive there, and now you're waiting for 4 hours to see a clinician, and you're waiting 5 hours to see a nurse, and then you have to wait all day long to pick up your medicine. Who do you report that to? Do they care? Is there any interest that you have this poor quality of service? So we've established and created these citizen feedback tools, so that way you're sitting there and you're having poor service, this poor quality that's occurring at a hospital or clinic, and now you have a mechanism or a means to report that. And so we've created this, which allows just average people within Kenya and Tanzania to report the services, the issues that they're having at particular hospitals and clinics. So it's not just a matter of the types of output in terms of, yes, I went to the clinic and it was open, but now am I receiving quality of service that's promised and that I'm paying for as well? So again, trying to get citizens and patients engaged. One example that I'm working on currently is in Guatemala. So Guatemala recently had its elections, and they've elected a comedian as a president. But the reason for that is because there was intense corruption at the president level, the vice president level, and below. So many people should be aware of that. So what we've been working on in Guatemala is that they have a law around transparency, that all of the information at the ministry should be open and available to all the citizens. Of course, the problem is they publish it in a book, they put it on the shelf, and then the average person in Guatemala has no access to that. So what we did is we came in and we worked on taking that information that's on that dusty shelf, converting it electronically, putting it into a dashboard, and then making it widely accessible to not just the average citizen, but to the ministry themselves. So the Ministry of Education, the Ministry of Health, we made a lot of the data in terms of budget. So for example, there's a couple of parent teachers organizations, PTOs, and we put the school budget information available to them online. And then we put it available and pushed it to their phone. So what happens is now you're the parent-teachers organization, and you see that the school that your kids are going to has absolutely no chairs. So they have desks, but they have no chairs. And you're wondering, well, where's the chairs? And so they were able to use the system, the data for the system to say that the local mayor, he did receive money for the chairs, but he didn't spend it. He didn't spend it on the school, he didn't spend it there. So the PTO organization was empowered to begin to ask him those hard questions around where's the money for the school, where's it going? And being able to then have that transparency and openness. So I've put the links, so everything I'm doing is freely available. The links are there. I please urge you to go to the website. You can check it out for yourself. There's no registration required. We've got an English and Spanish version, along with local languages in Guatemala. But we've also put in what's called the Open API, Application Interface. Well, I'm a firm believer in, okay, we've got this great data, it's curated, it's clean. Now, that's an opportunity for those who are social entrepreneurs to take that data set and create new opportunities and new ways to use the information on their own. So these new ways to use the data that we don't have access to either. So one example of that is was a hackathon that was held by one of the donors, by USAID. They had all this data, like 10 years of data around opinions for Guatemala. And so they gave a team of about 20 folks 24 hours. So they got this huge data set, it's unstructured, it comes from the ministry and all these other things they've been doing for the past 10 years. Please do something with it in 24 hours and let us know what you can do. So my team in Guatemala, we worked all night long. It was May 1st, is one of their holidays. And this is what we came up with. Again, I'm proud to say we won, but this is what we came up with. So in their data set, tons and tons of things have been collected for the past 10 years that are completely useless. We were able to say, okay, what are the top 3 questions that the folks in Guatemala and El Salvador, what do they care about? And of course, crime and violence. And what is the most difficult issues and problems they have? And what about their neighborhoods? How is the crime in their neighborhoods? And who do they trust to be able to address or fix these issues? So within 24 hours, we went through their entire huge data set, came up with what's called these nice little word clouds, and being able to start to see the perception within each country, of course, that crime is the #1 issue. Youth delinquency was another one. Problems with the economy. So these are the topics that are concerned to the citizens. And then their views on corruption. The government is very corrupt, absolutely. And then being able to then say, okay, have you been affected by this corruption and violence? So 2 out of 10 people were actually victims of violence in Honduras and Guatemala. And then they've seen the violence in their own neighborhoods, like 40% of them. And then who do you trust within your country to be able to address these issues? And as you can see, for example, in Guatemala, the tiniest, smallest trust was around the president and the vice president. That's very small. But the Catholic Church and the armed forces. So, and why this is important is because the information is already there. The data is already there. The problem and the issue tends to be, can you come up with social entrepreneurs who can figure out how to use and manipulate the data, not manipulate, but use the data to make it open and transparent for others to have access to. We're doing something very similar in Kenya as well, where we're collecting a lot of information from the health facilities and making it available not just to the citizens of Kenya. I mean, Kenya is far ahead in terms of e-government, but also IATI, the International Transparency Initiative, is also using this information, our information, to track, is DFID actually keeping its promises around the budget that it's spending in Kenya. So if a donor, USAID, CDC, for whoever says, okay, we're spending billions of dollars in country X, how do you know? Where's it going? How do you trace that? So we've put that data information available for certain countries for that traceability to occur and hold accountability. On the health side, we've developed open source, freely available software. Runs on a tablet. I recommend things of this nature using open source, freely available, things that work offline without internet. And then, of course, since I work in a hospital setting, being able to dispense to patients meds and drugs is important. Now, if you look at this picture, that smiling pharmacist on the left-hand side, don't trust her. There's only one person in the entire supply chain that cares that that drug, that medicine that she's giving to that patient is actual real, that it's active. The only person in the whole supply chain who cares is you, is me. You're the person taking the drug. right? So when you're sick, you want to make sure that the medicine you're taking is actually real, that it's authentic. Everyone else will put a counterfeit drugs from China, counterfeit drugs from meds. They'll get payments into the table. But you as a patient, how do you ensure that the medicine you're taking is absolutely authentic? So one of the teams that social entrepreneurs that we like that have a great solution to this, and it's a low-tech solution but works, is Sproxil. So Sproxil, they have a SMS scratch-off, so they put it on the blister pack itself. You scratch it off, you SMS the number, and it verifies and authenticates from the manufacturer that the product you're taking is authentic and real. And so you can go to Sproxil website. They have over 23 million verifications so far in the toughest countries, from Nigeria to Kenya to all the countries that have very high counterfeits. But what I like even more is not just for medical products, but they've expanded to parts. For example, how do you ensure that the brake parts that you're using in country that you're buying is authentic and real? No one wants to buy used brakes or faulty brakes. So they've also extended that. And then luxury goods. What is these called? Coach bags. You know, these expensive Coach bags that you see the people selling on the street, and it's cost maybe $2,000 US. How do you know you're about to spend $2,000, $50, $500 for some person on the street with this Coach bag? How do you know that that's authentic? So again, using Sproxil's really interesting technology allows that for you as a consumer to do that. And they're really expanding as well. So urge you to go to their website. The other thing around patients is reporting and feedback is, so we're using the Ushahidi platform. It's open source, freely available, allows people to report when they go into the clinic, there's no meds, there's no drugs. And so you'll see a lot of the data and then be able to see, okay, I went to the clinic, there was no HIV or lamivudine, the first line regimen, or there was no vaccine, or there was no bed nets, that sort of thing. So it's a really good platform out of South Africa. The latest sexy technology we and others are working on and I'm helping to co-fund as well is around UAV and drones use. This is my team in South Africa, my team in Tanzania. We're using UAVs. We're working with a company called Becton Dickinson, $50 billion medical device manufacturer. They're also interested in UAVs for supply chain management. You'd be able to use, yes? Unmanned aerial vehicle. So the drones, so when you talk about drones and UAV, like the drones that landed on the White House, that sort of thing, my team went through certification. So I'm just letting you know, before any of these technologies I mentioned, they have trainings and certifications around them, and my team has gone through certifications to use. There's actually a 3-day pilot training, for example. It's actually held in the U.S., Europe, and South Africa around UAVs, drones. But the idea is, can you address the issue of stockouts, of medical resupply? Often what happens is, let's say you're a patient, you come for your test, and it's a small clinic, it's a rural clinic, and they don't have any lab facilities on site. So can you take that lab specimen and send it off to the lab to get tested and returned? So today it takes up to 4 weeks in like rural Kenya and rural Tanzania and rural parts of Cambodia, rainy season, even longer. So how do you get that lab sample to get tested? And then how do you get supplies back from, especially during rainy season, where the roads are encumbered, back to that rural facility? So UNFPA is working with a couple of other UAV manufacturers on the hermetically sealed devices for the lab samples. And so this is undergoing efficacy tests as we speak to verify that you can actually have that lab sample taken by UAV drones. This is one example that we're proposing for Kenya. This is the rural. So the use case for drones, quite honestly, is only really truly rural, remote facilities. I wouldn't use them in an urban environment. It's just too congested. In an urban environment, you can get on a motorbike and deliver a lab sample. It's not a big deal. But when you're in a rural, remote environment, this is one of the hospitals that I'm working in now. And in order to get to the clinic and between the lab and the facility, it's over 48 kilometers by difficult road. And so what we're going to be doing is using a UAV to do the drone deliveries for the lab samples and for the resupply. And again, that's working with our folks from Becton Dickinson. They're coming up with this idea called smart hospitals. So today you have the hospitals, but tomorrow you can have the hospitals of the future. So they're working on a whole new idea. I'm also working with 3D printers. We've started using 3D printers in some of our clinics to be able to create tongue suppressors, clamps, just some basic devices that people need. Still early days, but it looks like it potentially is a good solution to some issues that they have. And creating like little medical bracelets, and just what we're seeing here is there's things that the rural clinics need that we can't think of today. And so having just a small 3D printer allows them to create those things immediately without waiting for the roads to get unclogged or for someone to help them. And we've created these little, let's call it pill dispensers, using 3D printing. I'm saying all this because we're running an innovation fund. So I want to make sure that you all apply. So this innovation fund, I think I mentioned this earlier. Within my company, we're managing about 3 different innovation funds for health, water, governance. That's why I was trying to show you different sectors. And we'll do, if you have a concept, so you haven't proven anything, it's just a concept, and it's a good concept, an idea, we'll fund that up to 600,000 US. And if your idea is actually proven out or is that pilot, and now you're looking to scale it up, we're providing funding up to 4.5 million for scale up. We received a lot of concept notes. Okay, I think it was 1,300 concept notes reviewed the last round, and then be able to fund. I'll share a few of those that we funded within education and WASH and those other areas. We have a second round that we've just closed as well, where we received 750 concept notes. So I'm in the middle of reviewing ideas that we're going to fund potentially around that as well. But I really wanted to just leave you with is that the third round, these are some of the ones that we've helped to fund. So I mentioned our good friends at Sproxil, ideas around treatment for mothers and children, biosanitation for schools. So it really runs the gamut around what's really good ideas that social entrepreneurs can submit and become effective. Some of the WASH things we think as well. So some of these are at scale. Some of these are pilot, and some of these are at scale. So it differentiates, depends on how much you're asking for during the submission. And then there will be a round 3 that's be coming up sometime this spring, and that's going to target specifically social entrepreneurs. So the first round, just about everyone who was an NGO group and others submitted, and so I got a lot of submissions. The second group, was much more people a little bit more thoughtful, because we started giving presentations about the types of ideas and people that we're looking to help fund. And the third one, I'll be doing some webinars and trainings around this, are specifically targeting social entrepreneurs, those who are, you've got a great idea, you're sitting in your garage, you're sitting in school, or it's already there, and you're looking to try to scale it up as well. So please go to the website. Just learn more information. I'm available to talk more about it, and also share some anecdotes around the types of things that are effective versus not in terms of trying to get funding. So thank you. That's my presentation.